The next is the herpes zoster virus. So the herpes zoster virus, it is caused by the reactivation of which virus? Varicella zoster virus. That is also known as HHV type 3. So the same virus that causes the chicken pox, it is responsible for the herpes zoster virus. So the herpes zoster, commonly known as shingle, occur as result of reactivation of the varicella zoster virus. So when suppose a person was first infected with the varicella zoster virus, usually during the childhood, they develop chicken pox. After recovery from the chicken pox, the virus does not completely leave the body, but it become latent, that is, it become inactive in the nerve cells, specifically the dorsal root ganglion. So the virus will remain dormant in the nerve cells for many years after the primary infection. So during this latent phase, the immune system keeps the virus under the control. So as the person ages, or if their immune system become weakened due to the factors like stress, aging, illness, or certain medicines, the varicella zoster virus will reactivate. So once it gets reactivated, it will travel along the sensory nerves. So it travels from the nerve ganglion to the skin surface following specific nerve pathway that are known as dermatomes. So before the characteristic rash appear, the individual often experience a prodromal phase that is characterized by pain, itching, tingling or burning sensation along the affected nerve path. So this is neuralgia. So within a few days of the prodromal symptoms, a rash develops around the affected dermatomes. So the rash, it consists of cluster of fluid filled vesicles on inflamed and reddened base. So this red is quite painful. And the rash is generally confined to one side of the body. Before the characteristic rash appears, the individual often experience a prodromal phase that characterized by the burning, itching, tingling. So this is known as neuralgia or neuropathic pain. So within few days of prodromal symptoms, rash will develop. The rash will consist of cluster of fluid-filled vesicles on the reddened base. So the vesicles quickly progress through stages of development. There will be pustule formation and crusting. So the rash will take about 2 to 4 weeks to resolve. So in some cases, even after the rash has become totally cleared, the pain will persist. So this is known as post herpetic neuralgia. So that occurs due to the nerve damage during the active infection. Other important terminology is what is zoster sign herpete. Infrequently there is dermatomal pain without the development of the rash. So that is known as zoster sign herpete. Upon healing of the lesion, scarring with hypopigmentation or hyperpigmentation, it can occur. Other is Ramsay-Hunt syndrome. Sometimes the chickenpox virus, it can reactivate in the nerve of the geniculate ganglion. So this might cause condition known as Ramsay-Hunt syndrome. So people with this syndrome will have skin sores in the ear canal and problems with the face and auditory nerves. The people might experience facial paralysis, hearing loss, dizziness, and ear-related symptoms. Few patients may experience a pain after the rash is gone. So that is post-herpetic neuralgia. Sometimes a person has recovered from the rash caused by the herpes zoster in the face nerve area. They might develop a condition that is known as granulomatous angiitis. So that can lead to stroke. Because the virus and the inflammation can affect the blood vessels in the brain. So again, the treatment for the herpes zoster is as similar as that of primary herpes simplex virus. That antiviral regimen could be given, painkillers could be given, drugs like acyclovir, famciclovir can be given.